Everyone, good morning. My name is Kimberly. I'm known on social media as the Fertility RN, and I'm so excited to be here with Nurses.org for this 24-hour Instagram takeover. I have been a fertility nurse now for the past 5 years. I'm known on social media as the Fertility RN, so please do not forget to go ahead and give me a follow. And today I'm going to show you what the day in the life is like as being a fertility nurse. It's quite a niche field where we focus on women's health, specifically when it comes to fertility, whether it's women who are trying to get pregnant, whether they're looking to preserve their fertility for the future, both by egg freezing and by embryo freezing, as well as third-party reproduction. There's so much we're going to get into, so please do not hesitate to ask your questions and follow along. I'm going to share with you all where I've been working now for the past 3.5, going on 4 years. This is known as CCRM New York, which is one of the leading fertility clinics in the United States. Hi everyone, I'm back. Lots of procedures that we had this morning, and I have a little bit of a break now. So I'm going to share with you all, before I get into the nitty-gritty details of what we do as nurses in fertility medicine, what exactly is reproductive endocrinology and infertility. So it's important for me to share what exactly endocrinology is. Endocrinology is the study of our hormones, and hormones are the chemical messengers driving all these different metabolic functions in our body, from our metabolism to our sleep to our hunger to our energy levels. And what we specifically work with is the fields of reproductive endocrinology. All of the hormones that are involved in our body regulating, whether it's for women, it is going to be your cycle and production of. Reproductive endocrinology for women is going to be the hormonal communication from our brain. That's going to include the hypothalamus, the anterior pituitary gland, connecting with a number of our reproductive organs, such as the ovaries, fallopian tubes, uterus, endometrium lining, our cervix, and the vaginal canal. They're all going to react and respond to a number of different hormones that fluctuate throughout our cycle. For men, this is going to include from the brain as well, in the hypothalamus and the pituitary gland, impacting the testes and sperm production. Physicians that work in this field are known as reproductive endocrinologists and infertility specialists. These are highly trained, double board certified physicians who are also OBGYNs who've completed their 4 years of training in obstetrics and gynecology before doing a fellowship in the field known as REI. So we work with them on a day-to-day basis, helping people achieve their reproductive goals. And let's get into exactly what happens with the procedures that we are typically doing as fertility nurses, helping patients with their egg extractions in order for the eggs to be extracted from their ovaries and either frozen in the laboratory, or they are going to be fertilized with sperm to create embryos. Let's get into it. So all the different treatments that we do for our patients, let's define what exactly is infertility. So according to the CDC, the American College of Obstetrics and Gynecology, and ASRM, American Society for Reproductive Medicine, infertility is defined as for people who are younger than 35 years of age, trying to conceive for 12 months with unprotected intercourse and unable to achieve a pregnancy. If one is 35 years and older, it will be at 6 months of trying to conceive and unable to achieve a pregnancy as well. And at that point is when it's highly recommended to seek out an appointment with a reproductive endocrinologist to understand what could be going on and why it has become a little bit more difficult to get pregnant. People ask me all the time, when is a good time for me to seek out fertility treatments? And it's exactly at that mark. If you've been trying for more than 12 months and you are younger than 35 years old, or if you're 35 and older and you've been trying for 6 months. But that being said, if you know that you happen to have some form of a hormonal imbalance, or you may have irregular cycles, you may have a history of PCOS, endometriosis, your partner may have male factor infertility, they may have had a vasectomy, they may have a number of different reasons why it may become more difficult to conceive, I really highly encourage that you seek out medical advice and an appointment with a fertility physician before you reach that year mark, if possible. It's always good to keep yourself informed and just keep yourself up to date with any important tests that could figure out what could be the culprit of why one is not pregnant. What's important to note is that when it comes to fertility medicine, it's not just for patients who are trying to conceive at the moment, but maybe trying to preserve their fertility for the future. One may not know if they want to start a family. They don't know what their future holds. They may want to be focusing on their career. They're living their best lives. And, at this moment in their time, in their life, starting family is not what they want. But the reality is that us women are born with all the eggs we'll ever have, and that number does decline with age. So while we could be out there living our best lives, our eggs just continue to decline in both terms of quantity and quality as well. So that's where fertility preservation has become a rising phenomenon in the healthcare field, where we are able to extract a number of eggs in a cohort, which we'll get into how we go about that, in a cycle, freeze them so they could be used for the future. I could really talk for the next 24 hours about all the nitty-gritty details of fertility medicine. I've been studying it now, like I said, for the past 5 years, and there's so much more that I still need to learn. But what you're all here today is to watch and learn from me what a fertility nurse does on the day-to-day basis. So that's exactly what I'm about to get into. I would say majority of the cases and the procedures that we do in the fertility clinic setting is known as a transvaginal oocyte retrieval. Our patients are here, whether it's for IVF or for egg freezing, that their ovaries have been stimulated with hormones for the past 2 weeks in order to grow and develop the eggs that are available at the surface of their ovaries. So like I mentioned, us women are born with all the eggs we'll ever have. That number does decrease with age. And what happens is that on a monthly basis, a number of potential eggs rise to the surface of our ovaries, and they are housed in these little fluid-filled sacs called follicles. Within that little fluid-filled sac, it contains one egg. On a regular monthly basis, our brain is telling one of those eggs to grow, mature, develop, and ovulate. But what happens is that only one of those eggs is going to grow, mature, develop, and ovulate. All the other eggs that were available that month are going to die off. And this is why on a monthly basis, we are losing eggs. But our goal as fertility nurses and the fertility doctors is that we want to grow and develop and stimulate all of those eggs that are available in a given cycle. So let's say you may have 5 follicles on one side and 6 on the other, hopefully yielding potentially 11 eggs. The younger one is, they'll likely have more eggs available. As the older one gets, they will have less and less eggs that become available on a monthly basis. This is because that number is declining with age, and we can't grow and regenerate more eggs as we get older. We're born with all those eggs that we will ever have. That number continues to decline with age. But what we're going to do in a fertility setting is that your reproductive endocrinologist is going to prescribe to the patient for 1 to 2 weeks hormonal medications to grow and stimulate all of those follicles to grow, not just one. And then in a surgical procedure, we are going to extract those eggs and we are going to send them off to the laboratory where they'll be evaluated, and either they'll be fertilized if you're going through the process of in vitro fertilization, or they'll be, I got cut off there. Like I said, I could be talking about this for hours. So what essentially we do is we stimulate all of those follicles that are available on a monthly basis. So now let's say it's August 1st. We will start a patient today who's ready to begin their cycle. They're on day 1 or day 2 of their menstrual period. They'll come on in to be evaluated. And if they're at the beginning of their cycle, these follicles are really, really, really small. They're always going to be microscopic, but they're super small. They're called antral follicles at this time. We are going to stimulate and develop them over the next 10 to 14 days, typically on average, with hormonal medications to grow and develop. And then once they are fully developed and hopefully at the point of maturity, we are going to extract them in a surgical procedure. That is known as the transvaginal oocyte retrieval that we do, and I'm going to show you how we do it. This is where my role comes in as one of the fertility nurses. So I work in the surgical center where we are involved with helping patients who are going to be having their eggs extracted, and that involves an outpatient procedure where it takes about a few hours from start to finish. They are going to be admitted into our surgery center about an hour before their procedure takes place, and that's when they are going to meet with their fertility doctor, an anesthesiologist, as well as one of the nurses to go over all of their consent forms. On into the surgery center. The operating room is back there, but we're not going to go there yet. There are no patients that are here at this time. All of our patients have left for the day, but it's a really beautiful surgery center that I'm blessed to be working in. This is where patients are admitted prior to their procedure, as well as where they will return for the recovery process. This is my amazing coworker, Andrea. Say hi.
Hi.
This is our amazing view of New York City. We're in the Big Apple. Like I said, all of our patients are gone for the day, and what I'm going to show you is what happens when I admit a patient, as well as what happens in the operating room and then the recovery room as well. So when I admit a patient to the surgery center, my number one priority is making sure that the patient feels safe, both physically and emotionally. It could be nerve-wracking knowing that you are about to go under a procedure where you will be asleep. It's about a 20-30 minute long procedure, but nevertheless, no matter how long or short a procedure could be, it could be quite scary even when it's only your first time or you've done this multiple times over and over and over again. One thing that I do at first, in addition to making sure the patient feels safe and comfortable, and this is included in that process, is confirming the patient's name and date of birth, that I'm taking care of the right patient and respecting their privacy. We give them a private room where no one else will be able to see them. They are only allowed to be visited by any of the medical providers, the anesthesiologist, as well as the nurse taking care of them. And at this time is when we will go over with the patient both their consent form for their surgery, going over with them their medical history and their anesthesia history as well, taking a comprehensive history down to make sure that we have all of their important medical information before they go under for the procedure itself, and as well as making sure that they understand their discharge instructions prior to the procedure, because after a procedure they may feel a little bit loopy waking up from anesthesia. So after the patients have been admitted, they are then going to be brought back into the operating room for their egg extraction. The egg extraction is about a 20 to 30 minute long procedure depending on the number of follicles that they have in their ovaries that we are going to drain. Remember, each little follicle of fluid-filled sac should have one egg inside of them. So let's go on into the operating room and follow me. So today I was working in the PACU, working with admitting the patients and as well as recovering them. PACU stands for, as many of you know, Post Anesthesia Care Unit. So I was not in the operating room today for setting up. I will be tomorrow though, so you'll see more about how we set up the operating room. But I did get a little bit of a film from our amazing scrub tech, Jen, who's gonna show us her little scrub sterile setup that she had done. But essentially, like I mentioned, when patients come into the operating room for the procedure, they're brought in by their anesthesiologist as well as their nurse. They're going to have their name and date of birth confirmed by an embryologist just to confirm the plan that they have for their egg extraction and if they're having their eggs fertilized or if they are going to immediately be frozen. Once that has all been confirmed, the patient will be safely put to sleep under the guidance of the anesthesiologist, who will be administering the medications propofol and fentanyl to assure that they are not feeling anything and that they are going to be completely pain-free for the procedure. Jen. Jen is one of our leading scrub techs. Jen has been working in the operating room now here at CCRM for going on 3 years. Been here for quite some time. So tell us what you're doing here, setting up for the procedure.
So we are setting up for our T-board retrieval. And here we have our ring forceps and our 4x4 gauze. These are the tubes where we collect the eggs.
All the fluid from the follicles that are going to go into these tubes and handed off to our embryology team.
Our draping here. This will go over our wonderful machine over here. Right? And
this is the machine that we are going to use where the needle is going to go inside the vaginal canal into the ovaries to pull out and extract each of the eggs that are within the follicles, the fluid-filled sacs.
That's right.
Alrighty, Jen, I'm excited for this retrieval with you. So hopefully I'll be able to link this image that I want to put right over here, but essentially what happens during the transvaginal oocyte retrieval. So the patient will be fully draped and sterilized. Us nurses will do an external cleaning of the patient, and then our scrub nurse or scrub tech will be doing an internal cleaning, fully sterilized, like I said, to make sure that the vaginal canal is clear of any medications or any toxins, bacteria that was there prior. What's going to then happen is that the reproductive endocrinologist will enter into the operating room where we make sure that they're fully sterilized and gowned up as well. And we'll be inserting an ultrasound probe into the vaginal canal to visualize the ovaries with a needle that will go in and puncture the ovaries and pull out the fluid from each of the eggs. Once the procedure is over with and all those eggs have been extracted and drained from the fluid, what happens then is that we safely wheel the patient out from their operating room bed. We transfer them over onto their surgical bed, and we wheel them out into the recovery room known as the PACU, where they will recover for anywhere between 45 minutes to an hour as we take their vital signs every 15 minutes, manage their pain, manage if they're nauseous, if they're vomiting, making sure that they're feeling very comfortable. A common thing that happens with our patients in the PACU is that as the anesthesia is wearing off, they begin shivering. It's just a chemical reaction that they have as anesthesia wears off after their procedure. So we give them bear huggers as well to make sure that they're feeling nice, warm, and comfortable. Again, number one priority is assuring their safety and making sure that they're feeling comfortable and safe prior to discharge. So something you may not know about fertility medicine is that the surgical procedures for an egg extraction could only be planned 2 days in advance. patients take a medication known as their trigger shot, which triggers and stimulates the final maturation of their eggs before they can be extracted. We can't exactly time our cycles the same way we could plan out other surgeries that PACU nurses may be working with patients for a number of different reasons. So today we only had 4 procedures. Tomorrow we have 6 plus embryo transfers, which I'm really excited to get to tell you more about. So make sure to continue to follow Nurses.org. Stay tuned, check out my account, The Fertility RN, and follow along tomorrow since this is a full 24-hour takeover, as I am going to show you more about the day in the life of a fertility nurse. Good morning, everyone. Kim here again, The Fertility RN, and we're back for another day of egg retrievals and now embryo transfers, helping patients achieve their reproductive goals, whether it is freezing eggs to be used in the future or creating embryos to get pregnant at this time or to preserve their fertility for the future as well. So today I'm going to show you what it's like and how we prepare the operating room as well as the recovery room process as well. So our operating room is nice and all set up. We have our sterile gowns and sterile gloves for our scrub techs. We have the endo-C camera in order for us to look inside the uterus to evaluate that the uterus looks nice and good in order for us to do an embryo transfer in the future. Obviously, we have our garbage in order to dispose of any materials that is used. We are going to clean the patient thoroughly before the procedure begins, making sure everything is nice and sterile. Here we have all of our scrub tech procedures and materials all set up, ready for collecting our eggs in order to clean our patients, making sure everything is nice and clean and sterile. And this is the machine that we use to help the eggs get extracted. Here we have the ultrasound probe that will be inserted into the vaginal canal with a needle that will be attached to it in order to aspirate each of the follicles. And